Have you ever wondered what causes erectile dysfunction? This is a question that has puzzled medical professionals and patients alike for quite some time. Erectile dysfunction, often abbreviated as ED, is a common condition that affects as many as 1 in 5 men over the age of 20. Despite its prevalence, there's a significant stigma attached to it, often shrouded in silence and misunderstanding. Erectile dysfunction, at its core, is a disruption in the normal process of achieving and maintaining an erection. But what is this normal process? Well, an erection is an interplay of psychological, neurological, and vascular elements. It begins in the brain, where sexual arousal triggers nerve signals that travel down the spinal cord to the penis. These signals cause the muscles in the penis to relax, allowing blood to flow in and fill the erectile tissues. This influx of blood causes the penis to expand and become rigid, resulting in an erection. When this process is disrupted at any stage, whether it's the initial arousal, the nerve signals, the muscle relaxation, or the blood flow, erectile dysfunction can occur. This disruption can be caused by a variety of factors, which we'll delve into in later sections. These factors can be physical, such as heart disease or diabetes, psychological, like stress or anxiety, or even lifestyle-related, like smoking or excessive alcohol consumption. The complexity of erectile dysfunction is why it remains an enigma for many. Despite advances in medical understanding and treatments, many men still struggle with this condition, often in silence due to the stigma attached. But it's important to remember that erectile dysfunction is a medical condition, not a personal failing or a reflection of masculinity. So let's dispel the myths, break the silence, and shed light on this common but often misunderstood condition. Understanding the causes of erectile dysfunction is the first step towards finding effective solutions. One might think that erectile dysfunction is purely a psychological issue, but numerous physical factors can contribute to it. Let's start by talking about heart disease. When your heart isn't pumping blood as well as it should, it can affect other parts of your body, including the mechanisms that lead to an erection. Clogged arteries and high blood pressure can limit blood flow, making it difficult to achieve or maintain an erection. Next, we have diabetes. This condition affects the body's ability to use insulin properly, leading to high blood sugar levels. Over time, high sugar levels can damage nerves and blood vessels throughout the body, including those that play a crucial role in sexual function. Obesity is another physical factor that can contribute to erectile dysfunction. Carrying excess weight can lead to a variety of health issues, including heart disease and diabetes, which we've already discussed. Furthermore, obesity can lower testosterone levels, which can directly impact sexual performance. Speaking of testosterone, let's delve into hormonal imbalances. Testosterone is the primary male sex hormone and plays a crucial role in sexual function. Low levels can lead to a decreased sexual desire and erectile dysfunction. Other hormones like thyroid and adrenal hormones can also affect sexual function when their levels are not balanced. These are just some of the physical causes of erectile dysfunction. There are others, such as certain medications, alcohol and drug use, and even some surgeries, that can contribute to this condition. The important thing to remember is that regular checkups can help with early detection and management of these conditions. Your doctor can provide guidance and treatment options based on your individual health situation. Physical health plays a significant role in maintaining sexual health, so it's vital to take care of your body. In our next scene, we'll delve into the psychological and emotional causes of ED, adding another layer to our understanding of this complex condition. While physical health is crucial, we cannot ignore the impact of psychological and emotional factors on erectile dysfunction. When we talk about the causes of erectile dysfunction, or ED for short, it's essential to understand that it's not just about what's going on in the body. The mind plays a significant role too. By delving into the psychological and emotional causes of ED, we can gain a more comprehensive perspective on this common condition. Let's start with stress. It's a common part of life, but when it becomes chronic, it can interfere with your body's normal functions, including sexual performance. High levels of stress can disrupt the balance of hormones in your body, which can lead to ED. Next, we have anxiety. Whether it's related to work, finances, or personal relationships, anxiety can take a toll on your sexual health. It's like a vicious cycle. The more you worry about your performance, the more likely you are to experience ED, which in turn fuels the anxiety even more. Depression is another significant factor. This psychological condition can lead to a loss of interest in activities once enjoyed, including sex. Depression often goes hand in hand with low self-esteem and feelings of worthlessness, which can further exacerbate ED. Lastly, let's touch on relationship problems. Issues like poor communication, unresolved conflicts, and lack of intimacy can lead to ED. When emotional intimacy is lacking, it can be challenging to maintain a healthy sexual relationship. The importance of mental health in relation to sexual health cannot be overstressed. If you're dealing with any of these psychological or emotional issues, it's crucial to seek help. Professional help like therapy or counseling can provide coping strategies and techniques to manage these conditions effectively. Remember, there's no shame in seeking help when you need it. Your mental health matters, and taking care of it is a vital part of maintaining overall health, including sexual health. Remember, mental well-being is as crucial as physical health when it comes to maintaining a healthy sex life. Did you know that your lifestyle choices can directly affect your sexual health? Let's delve into some lifestyle factors that contribute to erectile dysfunction, commonly known as ED. Firstly, smoking. It's no secret that smoking isn't good for your health, but did you know it can also lead to ED? The chemicals found in cigarettes can damage your blood vessels, hampering your body's ability to supply enough blood to the penis. This can result in difficulty achieving or maintaining an erection. Next up, alcohol consumption. While a glass of wine or a pint of beer here and there might not cause problems, excessive drinking can have a negative impact on your sexual health. Alcohol is a depressant, which means it can dampen your sexual desire and can make it challenging to get an erection. Drug use can also lead to ED. Whether it's prescription medication or illegal substances, some drugs can interfere with your body's ability to maintain an erection. Always consult with your healthcare professional before starting or stopping any medication. Last, but certainly not least, is physical activity, or rather, the lack of it. Regular exercise is not just good for your heart and lungs, but it's also essential for maintaining your sexual health. Physical activity improves blood flow throughout your body, including your penis. Moreover, it helps manage stress and anxiety, which are known contributors to ED. Now this might sound like a lot, but the good news is that by making healthier lifestyle choices, you can manage and even prevent ED. Quit smoking, moderate your alcohol intake, avoid illicit substances, and engage in regular physical activity. These changes may not only improve your overall health, but also enhance your sexual function. Remember, it's never too late to start making healthier choices. Whether you're in your 20s or your 60s, adopting a healthier lifestyle can have a significant impact on your sexual health. So, start today, because every step you take towards a healthier lifestyle is a step away from ED. Your lifestyle choices today can shape your sexual health tomorrow. So what have we learned about erectile dysfunction so far? Well, we've unraveled quite a bit, haven't we? We've delved into the enigma of erectile dysfunction, shedding light on a topic that is often shrouded in mystery and misinformation. Firstly, we discussed the physical causes of erectile dysfunction. We learned how medical conditions like heart disease, diabetes, and high blood pressure could be culprits. We also unpacked the role of certain medications and substances, showing how they can potentially interfere with the normal functioning of the male reproductive system. Then we moved on to the psychological and emotional causes of ED. We underscored the impact of stress, anxiety, depression, and other mental health issues. We highlighted how these factors can create a vicious cycle, where the fear of performance failure can in fact lead to the very failure one fears. Next, we explored the lifestyle factors that contribute to ED. We emphasized how unhealthy habits such as smoking, excessive alcohol consumption, lack of physical activity, and poor dietary choices can increase the risk of developing ED. We also pointed out how these habits can exacerbate existing physical and psychological conditions, thereby amplifying the odds of experiencing ED. Throughout our journey, we reiterated the importance of overall health for maintaining a healthy sex life. We highlighted how prioritizing physical fitness, mental well-being, and a balanced lifestyle can go a long way in preventing ED. We also stressed the fact that erectile dysfunction is not a condition to be embarrassed about. It's a health issue that affects millions of men worldwide, and it's nothing to be ashamed of. In conclusion, we've seen that ED is a complex issue with multiple potential causes. But remember, understanding erectile dysfunction is the first step towards managing it effectively. It's about understanding the interconnectedness of your body, your mind, and your lifestyle choices. It's about breaking down the barriers of embarrassment and stigma, and seeking help when you need it. Remember, understanding erectile dysfunction is the first step towards managing it effectively. Don't be afraid to seek help and always prioritize your health.